walked into his office to make an appointment on a Monday morning. Making the appointment, he walks into the office and says, "Are you making an appointment?" So I can see you right now, which I thought was great. Dr. Anand saw me that same day, examined me, put a camera down my nostril, and discovered that I had a deviated septum on the right. So then we set me up for surgery, and he told me that also I had an uvula, whichever way you pronounce it, which was a little bit larger than it should be. So that's going to be taken care of, which will relieve the snoring. And hopefully, everything will be fine, and I think it will be.
You all ready for surgery today?
I'm ready for surgery. Call me Gene. I'm not
No problem, Gene. No problem at all. Well, I'm glad you came by today. Just to tell you guys a little bit, Gene's situation is very common for most patients with sleep apnea. He's tried CPAP, he's gave it a good shot, but unfortunately he just can't tolerate that machine. And as a result of that, he was seeking for a different option. When he came into the office to see us, his story is again fairly common. He mentioned intolerance of the apparatus, but in addition to that, during the day, breathing is very difficult for him. So that gives us a clue that something is going on 24/7 that's causing resistance to breathing, difficulty breathing. And as Gene mentioned very, very well to us, he just felt that he would get more labored throughout the day. What we did very simply in the office was place a camera through his nose, and we just examined his airway from nose to throat. And right away, we could immediately see that his nasal passage was blocked. Gene was only utilizing about 50% of his nasal airway. So right away, when he's doing things like exercising, activities such as that, he's not getting enough oxygen in it. In addition to that, we also noticed that his palate, where the uvula hangs in the middle of the throat, is very, very long. That structure rattles consistently, causing a loud noise that we all know as a snore. But also, when he sleeps, that tissue falls back and causes blockage in the throat. So we're going to actually take care of both of those today. Improve his ability to breathe both day and night, but more importantly, to decrease the number of obstructions he has at night and to decrease his snoring, to give him an improved sense of breathing both day and night and bump up that energy too.
Good.
Good. Any questions before we proceed?
No, I'm fine.
Okay, I think you're going to do very, very well.
Good. Thank you so much.
Good to see you.
Nice seeing you.
We specialize in multi-level airway surgery. That's what sets us apart from other people. We do everything at the same time under one operation. It's much easier for the patient, and then ultimately it provides a quicker result. A lot of patients that we see that'll come in for something as simple as snoring will ultimately find that they have lots of blockages in their airway, and unfortunately a lot of these patients have undiagnosed sleep apnea. We'll then of course counsel them and send them home with a sleep study. They come on back, and then if they have sleep apnea, we can then offer them certain procedures. The biggest thing for all these people, the common thread, is that there's trouble breathing. And during the daytime, it results in, of course, labored breath, difficulty moving air through your nose or your mouth. And at nighttime, that trouble breathing results in sleep apnea. What we ultimately try to do is find out why. There's always a why. And we can do that in the office with, a few minutes with a little camera and a scope. And then after doing so, we can provide the patient with, a definite understanding of why they have trouble breathing. And that's where we get most of the benefit. And more importantly, that's where most of the patients improve with regards to breathing. And it improves their outlook both day and night. I'm going to disconnect you real quick. And whenever you're doing airway surgery, it's really important to have good communication with your anesthesiologist and your anesthetist in the room, because ultimately, this is the patient's airway, so it's important to have that connection. Okay. And then this is the part of the procedure where we go ahead and actually inject the anesthetic. This again allows us to decrease any bleeding, but also to decrease the patient's discomfort after surgery. It's important to remember that Mr. Dubrock, when we talked to him earlier, he also mentioned that he had bypass surgery not too long ago. A lot of patients, when they have sleep apnea and it's not diagnosed, it can lead to heart disease, heart attacks. So a lot of times, long-term sleep apnea that's undiagnosed and even untreated can lead to situations such as that. It's also been affiliated with stroke, with memory loss, with depression. It just goes to show you how important a proper night of sleep is for our overall well-being. A lot of questions that we get in the office circulate around the age. Mr. Dubrock is 71 years old. So really when it comes to age of the patients, age isn't a barrier, it's really what you have, the anatomy. And he's got findings. One can make an argument to go ahead and not do a surgery in a 71-year-old with this kind of medical history, but he's very well taken care of. His cardiologist has cleared him. More importantly, This is going to give him a lot more breath. So during this part of the procedure, we're now looking straight into the back of his mouth. We can see where his tonsils used to be. A key finding is that he actually had a tonsillectomy done many years ago. So right away when you have that, that decreases the post-operative discomfort in the procedure. So we're going to really focus on his palate. And what I can see here is his uvula is extremely long. It descends below the tongue. And that's the structure we're going to focus on in addition to his palate. And as we begin, we make a cut. It's really in an arc. So when you look in the back of a patient's mouth, they have the uvula that hangs down in the middle. What we do is basically smooth that contour out. So it's a nice arc after surgery is done. A lot of patients ask us, what's the purpose of the uvula? One of the main functions of the uvula really is to seal off the back of the throat when you swallow so that you don't actually have secretions go through your nose. In addition to that, it also helps funnel secretions down from the nasal region to the back of the throat, and we silently swallow all those secretions. So the key is, when you take this structure, you got to know how much to take to still preserve a lot of those functions, and that's the most important part. Resecting too much of this tissue can cause problems down the road, and so that's an important understanding to have in mind. So now what we're going to continue to do is then go to the nose and straighten out his septum, stitch. And then after that's done, the procedure is over. It takes about, 35, 40 minutes total. And so we'll see him back in 1 week in the office. We take out the splints from the nose, and he breathes a whole lot better at that point. The results are fairly quick. We'll appreciate results in about 3 to 4 days, decrease in snoring and improving in breathing too.